do that using real-world examples. I like to pull actually some of the concepts from real case law. After that, we'll do a deeper dive into the regulatory standards. I'll talk about some key provisions in the regulations, key tenets of defensibility, which I'll talk a lot about today, which are fair market value, commercial reasonableness, and not taking into account referrals. If you're not doing this already, your leasing program should be paying attention to those three things. How is your organization dealing with fair market value? How are you dealing with commercial reasonableness? And how are you showing that your leasing arrangements don't take into account the volume or value of referrals? Let's talk about the requirements of the Stark lease exception, including the new timeshare exception that went into effect in 2016. We'll talk about auditing leases, an audit process, and wrap things up with a Q&A at the end. If questions come to mind as I'm stepping through this, please submit them through the Q&A chat box so I can tackle them at the end. But again, we have lots to cover, and so let's get started. So, like I said, we'll start off with some introductory concepts and using those real-world examples. If you take nothing away from today's session, I hope you take away the concepts discussed in this slide. This is kind of my presentation in a nutshell. We have more and more financial relationships going on with physicians in healthcare. Leases are one type of arrangement that we're seeing. And I think as healthcare organizations try to get more creative with their real estate, try to get more creative in that outpatient setting, and they're going to be entering into more real estate type, leasing type arrangements going forward. We're going to probably see situations where traveling specialists look for timeshare opportunities on a more frequent basis, so I think we're going to see more and more financial relationships with physicians. And in addition to that, we have a very rigid and technical, especially Stark Law regulatory framework. Stark Law is one of the most complex, if not the most complex laws in healthcare. Behind all of this regulatory framework, there are pages and pages of commentary as well where the government is interpreted. So it's a really tough area. And so getting it right requires you to spend some time and energy and resources of your organization to make sure you're structuring things appropriately and are going about it with the right process. So we have a rigid framework, and we have aggressive government enforcement. We've seen more Stark Law cases in the last few years than we've ever seen, and I'll talk about that in a few slides. And then the way that the Stark penalty structure works is particularly challenging. If you have let's just say there's a lease, your healthcare organization enters into a leasing arrangement with a referring physician, and that leasing arrangement is outside the bounds of fair market value. And let's just say you're talking about a one-year lease, and the rental rate itself is $1,000 above the range of fair market value. Well, over the course of that year, there would be $1,000 of remuneration that arguably creates the Stark issue. If you have a Stark Law enforcement action, the $1,000 is not the damage figure. Instead, the referrals between the healthcare organization and the referring physicians that lease the space are used. So if it's a cardiologist and that during that 1 year, the cardiologist referred $2 million of inpatient or outpatient hospital services to the healthcare organization, the $1 million or $2 million is used as the damage calculation, not the $1,000 payment over fair market value. So we have, let's say, $1 to $2 million in potential damages. And then if that action's brought by a whistleblower, it's tripled. So then we immediately have from $1,000 overpayment between $3 and $6 million in damages, and that's not even counting the per referral penalties that also go in place in Stark. So that's why this is such a draconian law, and it has a disproportionate penalty structure that really has created enterprise risk for some organizations. I'm going to talk about the huge damage figures in some of these cases, and the point of this is that you got to get this right. right. And then you should be making sure your lease arrangements are defensible because of the enterprise risk involved. And that's why organizations are spending time and resources on ensuring their leases are compliant with Stark law. And they're looking to manage risk. And I'd say the bottom three bullets really line up the key concepts when thinking about your leasing program and managing risk. First of all, your lease arrangements with referring physicians have to be defensible under the healthcare regulations. So as you're entering into any lease, you should be asking the question to your legal counsel, whether in-house or external, how would we technically defend this law, or defend this lease? Why is it defensible? What Stark exception would we be looking to? Because you need to fit within that exception to make the lease defensible. So first of all, defensibility is critical. And second of all, you also should be focusing on demonstrating what I call the three tenets of defensibility, and they are fair market value, commercial reasonableness, and not taking into account referrals. And they are critical because if your lease arrangement is ever challenged, it's likely it will be challenged based on allegations that the lease was not consistent with fair market value, allegations that the lease was not commercially reasonable, and lastly, allegations that the leasing arrangement was entered into because you were taking into account the volume or value of the physician's referrals. And so it's critically important you're focusing in on those and developing good documentation and process around showing that you can satisfy those three requirements. And that really builds into the third bullet. Your documentation and governance process, how you go about your business planning, your lease program planning, your valuations really should be geared at supporting defensibility with these concepts. As you go about your day-to-day implementation of your leasing program, you are creating lots of documentation. You are creating lots of evidence, a paper trail along the way. And if you have an enforcement action later on, that paper trail, that documentation, the governance process you use to approve the lease arrangement is the history and likely will be critical if you have to defend the arrangement. And so when you go about designing your leasing program and developing your documentation, you need to be thinking about the positive regulatory focused story that you want to be able to tell later on. And you want to be able to trot all of that documentation out in case you ever have an enforcement action. And so the optics are important. The process is really important because you're going to be leaning on that later on if your arrangements are ever challenged. So again, I spent a lot of time on this slide because it really captures everything I'm going to talk about today, the importance of technical defensibility, the importance of those three tenets of defensibility, and lastly, having good documentation and governance processes, all critical as you think about leases with referring physicians. Just